pharmaceutical industry, you've really outlined a network of supporting interests that hold the whole structure in place, whereby a significant fraction of what we pay for a drug is being used to provide the advertising that's getting us to use the drug. And there's just something wrong there. But where are the pressure points to disentangle this? I mean, should we have more of a change the balance of public and private mix in drug manufacture, or how would you see addressing that?
Well, I mean, as I said at the end of my talk, there are some... I mean, for a start, there's a big, strong civil society network around the world that is working against the interests of Big Pharma. And I think this victory in India this week is a big one. That's a massive one, because a lot of the new patents that the pharmaceutical companies would like are on something that just slightly tweaks an existing formula. And what the Indian decision has said is, no, you can't do that. You can't exert a patent over that. Mm-hmm. So I think it's called sort of evergreening, where they sort of keep being able to renew. Yeah, so that is an important decision. Now, the reason that's become a big issue in India is because there's been a very active civil society movement in India, with people working from the grassroots, with people like my colleagues Afroula Chowdhury, who I mentioned in Bangladesh, who have actually set up their own pharmaceutical manufacturing plants. They were told it wouldn't be safe, the drugs wouldn't be so effective, but in fact 30 years of experience has shown that of those essential drugs that the World Health Organization recommends, they're actually quite easy to manufacture. Very often, if you can overcome the patent issues, they become cheap. There's also an increasing number of middle and low-income countries, or middle-income countries, who are manufacturing their own drugs. And again, Brazil, Thailand, and India are foremost there. So I think there is an increasing awareness around the world, both from some governments, particularly middle-income governments and civil society, that this issue is both an outrage and should not be allowed to continue. There's a huge number of drug reps who are just selling drugs, just peddling drugs, and I really don't think they're any different in lots of ways to people selling illegal drugs. I don't think it's it's causing as much harm.
That sounds like an opportunity for you, Alex, to come in.
Chris, thank you. There are a number of disparities, international disparities, that are just unspeakable and indefensible in relation to pharmaceutical drugs. And one that I'm concerned about is the unequal distribution of prescription opioids for pain relief around the world. And the way it works is that countries which comprise 15% of the world's population, which includes Australia, by the way, consume 87% of the world's legal opiates. So if you're in Guinea-Bissau and you're dying of cancer, the chances of getting a decent dose of opiates to control your pain relief are very low. And if you're in Australia or Denmark or US or Canada or somewhere, very good chance that you'll get reasonable pain relief in your demise from cancer. This is outrageous. The United States, which accounts for 4.7% of the world's opiates, consumes 49% of the world's legal opiates. I mean, these disparities are gross. And the World Health Organization, very belatedly, is now starting to do something about this. But this forms part of the international regulatory system for illegal drugs. And one of the objectives of the whole system that was set up under the United Nations with 3 international treaties, one of the objectives was to ensure adequate supplies of prohibited drugs for medicinal and scientific purposes. And that hasn't been achieved by any means, at least not for the people who live in most of the world's poorer countries.
Can I just thought, yes, sorry.
I mean, it just strikes me that the word outrageous has been used several times, and it is outrageous and it's unfair and it's terrible. But I'm just wondering whether it's too easy to blame the pharmaceutical companies. In the same way that, the British Chiropractic Association is suing me, I think it's outrageous, but that's what they do. They defend their members, and it's their job to protect what their own interests, and so they will attack other people. Pharmaceutical companies, it's their job to make obscene amounts of money, and they do that however they can, whether it's spending all their money on advertising or campaigning or lobbying. The purpose, the person that should be stepping in here, it's the World Health Organization, it's the governments. It ends up being the Bill and Melinda Gates Foundation who seem to be doing more than anybody else. So I think in a way, if we blame the pharmaceutical companies and put all of the blame on them, we forget where the real agent of change is likely to come from.
No, I agree with that. You're absolutely right.
I mean, you're absolutely right. But in a way, the issue is that we need a global regulatory system as well as a national regulatory system. I mean, for instance, the reason that so much spent on advertising drugs in the US is that you can advertise direct to consumers. So you get ads in the paper that say, persuade your doctor to give you this drug. Well, in Australia, we've resisted that. And that's a very important thing and one of the value of having good, strong government. Mm. And the big message there is, I think, is that we need to regulate these companies and ensure that they pay tax and ensure that their practices are ethical and restrict them so that what they do does maximises the benefit and minimises the costs.
I think it's time to move on, and we should ask for questions from the floor. And we've got a first questioner there.
Thank you. I've got a couple of questions. This is specifically directed towards Simon. I can understand where the chiropractors and the homeopaths want to have a go at you after listening to you. But I haven't had anything discussed about the supplements, and there is a growing industry about the food supplements. I want to hear your comments about their effectiveness and whether there is any evidence. We're talking about vitamin supplements and things like those in terms of their impact on health. You're talking about the risk and the benefits.
Sure.
And another question is more towards the panel. And this is an issue about we're talking about poisons, we're talking about drugs. How about the food, food additives and the preservatives? Most of them legal. They go through the processes and they are allowed to be put in our foods and drinks. And what's their impact on health? Has that been an issue that has been considered? And should they be considered illegal drugs, or where do they fit in the whole health agenda?
You want to start with the
first? I mean, I think you're right. Are they? Where is the boundary between a drug and a medication and a food supplement and a food? Where is that boundary? And unfortunately, in terms of our book, it's probably where we're weakest. We have a very small section on food supplements because we sort of felt it's moving towards the food and nutrition end of the spectrum. But, in some cases, people have vitamin deficiencies and they need supplements and they have, mainstream health benefits. At the very other end of the spectrum, you have people like Matthias Rath, who was selling vitamins to South Africa in the hope that they could treat HIV. And a friend and colleague of mine, Ben Goldacre, wrote an article for The Guardian probably 2 or 3 years ago criticising him for this. And he was sued for libel. And it cost £500,000 to defend that libel action, which Ben and The Guardian eventually won. But those were the sort of outrageous claims that were being made that just aren't backed by evidence and can cause genuine harm.
Do you want to take it up, Alex?
Well, just in terms of safety for the last speaker, the fat-soluble vitamins, that's vitamin A, vitamin D, vitamin E and vitamin K, can accumulate and be toxic, particularly vitamin A, which is contained in the livers of polar bears. So if you get lost in the North Pole and start eating polar bears' livers, you die from vitamin A poisoning. But the water-soluble vitamins B and C will be passed go into the urine if taken in excess. So there's no danger of toxicity from having too much vitamin B or vitamin C.
I think you've highlighted a really good point. I mean, the whole way in which we manufacture and consume food now is becoming, ironically, in rich countries, a health risk. There are lots of claims for the food. We know that a lot of the manufactured food is high fat and high sugar, and that's driving the increasing weight in the population. And I think this is a good ABC watching and listening audience. How many people saw the Hollow Man on the food industry? No, so you'll know the power of the food industry. You know, the poor dietitians get to see the advisor. The food industry was straight through to the Prime Minister to put their point. And suddenly we watered down, in this hypothetical story, we watered down a campaign that was really going to regulate and control the food industry to let's try and change people's behaviour. And that's the politics of what's happening with our debates about obesity. You know, it's being reduced to try and tell people to eat healthy food, do more exercise, whereas in fact we need to control the sale of unhealthy food, the advertising of food to children, etc. So I think you raised a really important point.
It's an ever-expanding issue. Yes, question from there?
Yeah, for Simon. I've been going to chiropractors for 37 years, and I've not in that time been particularly sick, but I do recall memory loss, back pain, limping and so on being instantly cured by the treatment, and lately impotence. And I'm wondering, among other things, this isn't the last question, about the difference between a perceived cure for impotence and a real one. And I also took my dog Umpa to this chiropractor 3 times when he was suffering from back pain and limping and was totally cured. Can you tell me...
He said his dog?
Can you tell me how a dog can suffer a placebo effect?
Right, gosh. I've often heard it in the context of homeopathy, about pets and homeopathy, and people say, you know, my pet cat has homeopathy and always feels much better. You know, how can it possibly feel the placebo effect? There are 2 answers to that. Well, there are 3 answers. One is that maybe homeopathy works, or chiropractic works, and these pets genuinely feel better. Another possibility is that it's our perception of our pets. We love our pets, and we want them to get better, and we look for signs of recovery, so there's a sort of indirect placebo effect. The third possibility is that there's nothing there at all, and you know, the homeopathy or chiropractic's ineffective. Now, science, I believe, is incredibly open-minded. I think scientists are the most open-minded people in the world, and if there's a claim, even if it's bizarre, if there's some evidence to back it up, scientists will tend to try and investigate it. So there have been clinical trials with animals. I don't know about animals in chiropractic, but animals in homeopathy certainly. And you take 100 cattle with, I think one of the most recent trials was cows with mastitis, 100 other cows with mastitis. You give one of them homeopathy, the other ones you give them a sugar pill, although it's hard to tell the difference. The improvement's no different. Calves with diarrhea, same experiment, same clinical trial, no different. So I suspect that if a clinical trial were conducted on animals in chiropractic, we'd get that sort of result. Although for back pain, I'm not wholly negative about chiropractic. The odd thing is, and I can't remember if I mentioned this, I mentioned it to somebody earlier today, but I can go back to London and I can be a homeopath. I can treat people tomorrow. I can put a label on my door and treat people as a homeopath, but I can't treat their pets. If you want to treat a pet, you have to be a qualified vet. Anybody can treat a human.
Yes, next question. Thank you.
Again, to Simon, you seem to be the popular man of the moment.
Or unpopular.
I just wonder how recently you've updated your knowledge of the research that's come out of traditional Chinese medicine in Australia. There are degree courses, master's courses and PhD courses, and recent research about the efficacy of IVF by Littleton et al. And the research by Caroline Smith about infertility and the efficacy of acupuncture have very amazing results. so what I would say about the fact that you can say that acupuncture doesn't work is that the research is only just beginning within the scientific paradigm, and current research is showing an incredible efficacy through the higher education system. The other thing that I'd like to say is that knowledge is culturally based and constructed within a society. In China, I once asked a professor of medicine in China, did he think Chinese medicine worked? He said, well, there's 1 billion of us. And I think that speaks for itself, that there's, in China, they use both Western medicine and traditional Chinese medicine in their medical training. It takes 8 years, and within that system, some people go on to be acupuncturists and Chinese herbalists, and others go on to be Western medical people. On the wards in the hospitals, they compete for results. In a country that is so vast and so many people, TCM works with hand in glove with Western medicine, and TCM manages to catch the things that Western medicine can't do, and Western medicine catches the things that TCM has. It has its limits too. It doesn't have that broad thing.
Thank you very much.
I mean, just to unpack those, just very rapidly. I don't think knowledge, scientific knowledge, is culturally based. They've got gravity in China, we've got gravity here. It's the same the world over. If acupuncture works in China, it should work here. The fertility studies, I'm not convinced by the studies. There have been 4 or 5 now, and when you look at the meta-analyses, it's not convincing. And you're saying that, we'll find the evidence to back up the claims. I think you should have the evidence before you make the claims. I think it goes the other way around. We wouldn't accept that from a pharmaceutical company, and I don't think we should accept it from alternative therapies. This idea that 1 billion people can't be wrong, again, it's not a popularity contest. It's not even a democracy, unfortunately. And also, we could say, for 4,000 years we believed in bloodletting. It's only recently we've not believed in it. Surely we're wrong and they're all right. And finally, I think the saddest one of all is the idea that universities are now teaching subjects like homeopathy. In Britain, there were 4 or 5 universities, fairly respectable institutions, offering a Bachelor of Science degree in homeopathy. Now, I did a Bachelor of Science degree at Imperial College London. I'm very proud of it. I learned a body of knowledge that had been accumulated over centuries, so that I could be a little beginner scientist and perhaps begin to develop knowledge of my own. But I learned about what science is, scientific knowledge, and how science progresses. And the idea that you can have a BSc in homeopathy is just tragic in the 21st century. I think it's sad for those universities, it's sad for the other academics in those universities, it's sad for the students who are being fooled into believing that they're learning something serious, and I think it's sad for the patients who down the road will think, oh, this must work, they've got a Bachelor of Science degree from such and such a university.
I think Londa has a comment.
I've been listening to what has been said about the placebo effect, and what I don't understand is why medicine, what we call Western medicine, doesn't learn how to capture it and use it to its own benefit. I look at medicine in the 18th century, and I look at Europeans fanning out across the globe, and they're looking at other medical traditions. Mostly Europeans who go to tropical areas die because their medicine is completely ineffective. So, in a sense, they're the weak people needing help in other areas in the 18th century. But then I watched them go through and look at these different medical traditions, and what's interesting to me is that they're weeding out constantly. They're taking only what speaks to their scientific traditions, and they're leaving aside all the other aspects, whether it's Chinese medicine or I'm looking at different traditions in the Caribbean. They're leaving aside all these other ways that people heal themselves. And I think that clinical trials are great, and this is all very helpful, but we need to, I think, open up and see what other parts of the human experience have been left out. And I really think that this is necessary as we move forward with our big pharmas and our other things. And science is definitely cultural.
Yeah, I just wanted, Simon, I think, to sit there and say any science is totally embedded in its society, and a good scientist knows that any fact is only there until it's disproven. And, we have to remember that. And so often I get so frustrated when I listen to scientists talking as if they have the truth, whereas in fact what they have is a set of information that's been interpreted culturally and may be right for the moment, but we may discover in 10 years it was completely wrong.
I'll happily change my mind. If somebody does a meta-analysis of homeopathy tomorrow and there's another one a year later, I'll change my mind in an instant.
Yeah.
I'm quite prepared to accept that facts can change. What I'm more worried about is facts appearing out of thin air. Those are the facts that I worry most about.
It is not inconceivable, and I certainly keep it open, that in 100 years we will find gravity was wrong. In fact, it's explained by something else.
Absolutely.
And I'm not so convinced. So I don't think there is anything that we can say, this is proper science,
but what we can,
and this isn't science.
But what we can say is, to the best of our knowledge, on the best available information, this is where we're at. And I think you're right, on the placebo effect, it's very powerful, and good doctors use it all the time, and bad doctors don't, and they fail. And there's more research going into this all the time in terms of at the level of which pills give us the best placebo effect. The bigger the pill, the bigger the placebo effect. Unless it's a very tiny, tiny pill, in which case the placebo effect is even bigger. If the doctor gives you the medicine hand to hand, the placebo effect is bigger than if you get a prescription and have to go and get it from the chemist.
Have you ever seen a doctor give you medicine?
Well, no, these are the tests that are being done that in time this may be a way of dispensing in the clinic may be better than dispensing in the pharmacy. So I agree it's a very important area. And I'm not standing up for big pharmaceuticals. I think there are big problems in mainstream medicine. And I think mainstream medicine could learn a lot from the bedside manner of some alternative therapists. But when claims just don't stack up, and when the evidence actually counters them, that's the one thing which to me seems clear we should be blunt about.
I think we still have to hear from Alex on this.
Yes, very important comment that you made. I agree with it. And an area where we really see this as being phenomenally important, we see it in many areas, but one area it's particularly important is chronic non-cancer pain. It's clear that the medication that's prescribed for chronic non-cancer pain is very important, but it's also clear that it's not enough. And it's not quite clear exactly what the other part should be. Because we don't really know that, it's very hard to support it and to fund it. And without the support and the funding and the training, it's hard to have, say, support groups for people with chronic non-cancer pain. It's hard to get physiotherapists to work with the patients. Yet we know that all that other stuff, relaxation, we know that helps people a great deal. So by all means, we need to move to a more comprehensive model, but we're some years away from working out what those other bits have to be and how they should be deployed.
I think we'll have to stop there. I'm sorry, we're over time. So, look, I'd like to thank you as an audience for having been a very...